Hi everyone, my name is Croal and I'm President of the College. I'd like to welcome you today to our new Trainee Day. Sorry I can't be there live today, so I pre-recorded this message. Pathology is hugely important to healthcare, which I'm sure you all know, with up to 95% of healthcare interactions involving pathology, ranging from blood tests to histology to the multitude of other services pathology offers. We are 17 very different specialties in pathology, and we welcome everybody from everywhere who's part of our pathology family to be represented by the college, and it's with that I welcome you today. Our 17 specialties cover a diverse range of interests and areas of healthcare, some of which involve direct patient contact, such as with hematology, microbiology, and ChemPath. This may be ward-based activity, outpatient clinics, and even directly with patients using home testing. And in some cases, this may involve the complete management of patient care with overlap to areas such as general medicine. But we are all vital to healthcare nonetheless, and we work together across both the pathology disciplines and also with much wider ranging multidisciplinary teams, MDTs, across primary and secondary care. So something for everyone, really. You will, of course, inevitably be linked to only one of these disciplines as part of your training, but knowledge and collaboration with the whole of pathology is going to be important both as a trainee and as a future consultant. So what are we about? Not just diagnosis, but also screening, prevention, and directing and delivering treatment to patients. There are many opportunities both as a trainee and as a future consultant, such as research. Pathology is vital for most clinical research because we are so pivotal to patient pathways. So not just research looking at new tests, but also using our tests to gauge the success of new treatments, such as drug trials, which are hugely dependent upon the need to monitor the success of any new drug by using pathology testing. Doing research can mean lots of things, of course, and does not necessarily mean going down an academic training route or even a future academic job. I have spent time both in academia and in the NHS, and research is just as important in both. So as trainees, becoming interested, linking up with existing research teams, volunteering your time, developing your own ideas, getting involved, that's the key message here. And there is no quick route. Research activity needs to be built up. Get some ideas, get some data, present at local meetings, develop abstracts, posters to larger meetings, and even oral presentations may come your way. And finally, publishing. But publishing is not the be-all and end-all. Initially, it's usually as a minor offer as part of a team, hence the importance of lining up with established work. Yes, volunteering and doing some graft, some you win, some you lose, but you need to be in the game to get anything out of it. Teaching is another area that holds numerous possibilities, and as trainees, you will begin to deliver important pathology teaching to undergraduates, postgrads, early stage trainees, scientists and allied healthcare professionals, many of whom will form part of your future MDTs. And you will also learn from them. I've learned a huge amount over the years from clinical scientists, biomedical scientists, and other areas outside of path, such as dietetics, nursing, and so on. Teaching and research, of course, go together and will continue to be part of your future careers, whatever you do. And of course, they will form the basis of those of you who do choose pure academic careers. Within each specialty, there are, of course, options for specialising in specific areas. This needs some thought, as it may be linked to both your interests or indeed an essential requirement for a future job you may want in a particular place. Every pathologist is different, every job is different. Looking back, I specialise mainly in intravenous nutritional support, cardiovascular risk, and bariatric surgery services. Research-wise, demand optimization, large randomized control trial support, and new biomarker innovation were some of the areas that I focused on. Some of this, of course, happened by accident, but some of it was also my choice. There's no rush to finish training and move to that CCT point in as short as possible time. You may find yourself at the top of the training escalator very quickly, but you may not be competitive enough to compete for that job that you want. Take your time, expand your portfolio and CV so that when you reach the end of training, you can get to the jobs that take most of your interest. Job opportunities are much wider than the past, and there's a lot to think about. It's not just about NHS careers. There's academia, there's industry, private sector, jobs abroad, and even other sectors. I'm a biochemist, good with numbers arguably. And even areas like hedge funds are after people like me. Well, not at my stage, but certainly trainees coming out. But don't forget, while you work hard and you get paid for that, you are inevitably costing UK taxpayers to train you. So at least personally, I have always felt an obligation to remain within the NHS as much as possible. And that is more important now than ever before, given the challenges this country faces. So don't forget that, although inevitably it's your own choice. Work-life balance within pathology is good, and it may be a reason why you chose it. Flexible working is now easier to do both as a trainee and a consultant. Working from home or indeed anywhere is now possible with online MDTs and reporting and digital pathology opening up many new doors. It does not mean we work less, it just means we work differently and have more options. So while personally I have not had to spend, for example, a single night working in hospital because of my job, I have chosen at times to work long hours and volunteer my own time because I want to, either to benefit me, my department, or patient care. But most importantly, choosing to do it rather than having to do it is what makes all the difference, in my opinion. The college is a relatively young college, forming in 1962. It's here to support all of our pathology specialties. This means that whatever specialty you are in, the college is there to support you, to help you, and to lobby for you to have the support and resources you need to be able to provide the healthcare outputs to patients that they need. We facilitate rather than directly deliver training, of course. That's mostly done locally. However, we do write the curricula, deliver examinations, host training portfolios, and sign off the CCT at the end. We also provide many useful learning opportunities, such as the Developing Pathology Portal, an award-winning platform to assist learning and examination preparation. Also, there's a multitude of webinars, tutorials, and symposia that will come your way. We have a trainees committee. Please try and get involved, and many other activities associated with public engagement, media, and learning. So there's lots to do. Let me finish though with some harsh truth, some elephants in the room. We all work in medicine at a very difficult time just now. Under-resourced, understaffed, waiting list pressures, financial pressures, and in some cases failing services. There are no short-term fixes. This may at times, of course, impact training and make the day job harder. I urge you to try your best to be more sympathetic and more of a team player, supporting each other, wider colleagues, and of course your trainers when times are tough. Secondly, another hot topic is exams and exam cost. Exams are expensive. I know this. As a college, we deliver multiple stage exams for the 17 disciplines and our groups. We only have a small but dedicated team backed up by hundreds of volunteer examiners. Yes, volunteers, we don't pay them. We do not also make any profit out of exams. The cost of exams is what it costs to deliver them. So we keep the cost as low as possible, but despite this, we recognise the difficulty, especially in today's climate. And so make sure you take advantage of things like tax rebates that are available on exam fees to help reduce this burden a bit. Your journey with this college begins now and will hopefully span your entire career, supporting you in CPD, education, guidelines, standards, and of course, representing the profession to government, the media, and the public. Colleges are going to be a vital part of your future careers for your future professional well-being and the standing of our disciplines. But remember, colleges are not a them and us situation. We are all largely volunteers, including me. You're part of this college now. This is not my college or indeed your college, it's our college. I wish you all the best in your future careers and especially the training period you're now entering. You will not regret your choice. Thank you.
Thanks very much to give you all a little more of a feel for what the place the college has to play in terms of your futures. Staying on that theme, our next presentation for this morning is from Joe Brinklow, who's the Director of Learning at the college. Joe oversees everything about training and assessments and exams, and is a fantastic source of information whenever we find ourselves in a tricky situation. So Joe's going to tell you today about the role the college plays and basically what the college does, so you have a really good feel for how it all works. So I'll hand over to Joe now.
As Bernie and everyone else has said, welcome to your college. There is a huge array of work that goes on in the college, but primarily when you join us as a trainee, all of the things that you see here on this screen are probably the primary things that you will engage with. The college has a large number of committees. I know we keep saying it, but it's really important to remember that the college has a huge number of specialties. The official number is 17, but with all of the subspecialties and special interests and things, there are a lot of different specialist areas that are covered by the college. And the main specialties all have their own committee where they discuss the things that are important for them and important for their specialty, and producing guidelines, flagging issues and all of those kinds of things. Within the learning area, there are also training committees. So we have one for chemical pathology and then one for cellular pathology, and then some infection committees as well for the other specialties that we look after. And as Bernie said, you'll be hearing from some of the trainee reps that sit on our trainee advisory committee as well. You hopefully will have had a look at your curriculum, and again, I'm not going to sort of do any spoiler alerts for some of the things that are coming up later, but you'll already know that through the assessment team we develop all of the workplace-based assessments, and then the college examinations as well, and also the LEP system, and you'll be hearing from Alastair about that later. To complement the curriculum and the all of the things that go along with that, we also produce ARCP guidance as well. They're really helpful just in terms of providing a summary for you every time you're coming up to the end of the year and preparing for your ARCP, just about making sure that you've done everything that's expected of you. So please make use of those. You'll be hearing again from Luke about the pathology portal, so I won't talk about that. But the college can also provide lots of advice and guidance for you throughout training. Most trainees at some stage might decide to go out of training for a period, perhaps to undertake research or to undertake training elsewhere for a little while. Or might decide to train less than full time or have periods of absence from training. And all of the way along, you can contact the college at any point for advice about that, the effect that that might have on your CCT. We're just about in the next couple of weeks to release some new guidance for all trainees about processes for having various periods of training approved and perhaps accelerating training. So please keep a lookout for those. Now you're registered with the college, you will receive that information automatically once we publish it on our website. And as Ronan's talked about, it might seem a very long way away now, but it will go very quickly. When you come to the end of your training, the college is also responsible for recommending you for the award of your CCT. And that's why it's so important that we gather the information about your progress through training all the way along, because our responsibility to the General Medical Council, who issue that certificate, is to reassure them that you have completed the training that's set out in our curriculum. The college is UK wide, and also we have a large number of international members as well. About 25% of our members are from outside of the UK, but there are regional structures in place within the college. There are regional councils. Just last week we had a Celtic summit at the college, listening to our colleagues in Northern Ireland, Scotland and Wales about some of the challenges that they're facing. And also, obviously, as you'll know, your day-to-day training takes place where you are in your location. So there is external input to deaneries, LETBs, whatever the new name for them is at the moment, to your training at certain points as well. So having an external rep on your ARCP, for example. One of the other roles that I have in the college, in addition to training, exams and assessment, is to oversee the work of the college's international team. That's primarily because there is a huge interest in the college examinations. They are internationally recognised, and there is still a lot of interest from international medical graduates to come to the UK and undertake periods of training with us. And perhaps you might have benefited from this already, but we do provide support for international medical graduates with GMC registration. Thought I would also mention our webinar resources that are provided through International, because a lot of those resources will be helpful to you as well. So, for example, in the last couple of years, we've undertaken some funded projects with the Ghana College of Physicians and Surgeons, who were rolling out their own curricula in a range of specialties, including chemical pathology, and asked us to provide a series of webinars to support the learning for those curricula. And you'll be able to find all of that on the college website and go back and have a look at those webinars, and they will be useful to you as much as they were of use to the trainees in Ghana. And we're also currently undertaking a much larger chemical pathology project that's based primarily in Nigeria, Ghana and Kenya, and that's really around improving training standards and professional standards in chemical pathology, where there are, in some of those countries, a real dearth of chemical pathologists, and trying to support the faculty there and build them back up again. So very soon you will start to see a huge number of resources available on our website. We have monthly and quarterly webinar sessions all around chemical pathology professional development, and there's going to be a series of point of care testing webinars as well. So again, do keep an eye out, because all of that will be freely available on the college website for you to dip into whenever you would like to. Just to slightly change the subject for a second, I just thought I'd mention the Totem Pro card that we offer to our trainees, or offer access to, I should say. So we have teamed up with the Totem company. You can buy this card. I think it's about £15–20 for a year. If you buy it for up to 3 years, it obviously works out much more cheaply, and it does give you access to a range of really good discounts for lots of different things, including train travel, but also discounts at a range of shops, both online, in the high street, and all of those kinds of things. So do have a look. I would say that quite often they do a really, really good deal around Black Friday, where they sort of reduce the price quite a bit, which is coming up fairly soon. So keep an eye out for that if that's something that you're interested in. So what else does the college do? So the college has about 70 staff. There are 5 different directorates, so including learning, but there are 4 other directorates. And the college really provides services to our members throughout their career, and that starts even, when you might be thinking about a career in pathology. So we do quite a lot of activities to draw attention to undergraduates and foundation doctors about a career in pathology, trying to encourage them and to think about that. We understand that sometimes it can be difficult when you're an undergraduate and you're faced with a very wide curriculum to really get to grips to know about what pathology as a career can offer you. So we have a range of things that we do. One of the things that's really one of our primary focuses at the moment is looking at workforce. In many of our pathology specialties, there are shortages, and so the college is taking a lead in gathering evidence about that, gathering evidence about our workforce, not just numbers, but also looking at things like well-being as well, and using that evidence to lobby government to advocate for pathology services. Most recently, we submitted a submission to Lord Darcy, who's undertaking a review on behalf of the new government of the NHS, and you can see information about that on our website and what we said. We also provide continuing professional development portfolio and revalidation support. There are guidelines, data sets, all sorts of information that come out of our committees to support you, and you can use those as you're developing in your career as a trainee as well. You'll also receive the Bulletin, which is a quarterly magazine for our members, and lots of other things there. As you can see, there's a series of webinars that take place that support all of the different specialties in the college. And we also engage with the public as much as we can to try and improve the understanding of pathology. And this is just a screenshot of, again, this is from the website. So if you had a look on the homepage of the website, you'd see the squares to the right of this screen, and the document on the left, the election priorities, was what the college put together prior to the general election earlier this year to really highlight the importance of pathology, making sure that the new government that were coming in were aware of that. And then the team have been working since then to make links with new MPs and raise the issues that are important to us. I think you'll probably see this slide a lot. I think a lot of people provide this slide, but there is a whole section on the college website as well that's dedicated to trainees. And if you look on there, you will be able to find all of the information that you need. So your curriculum, your syllabus, the assessment information that we have available, the exams information, and so on and so forth. So please do take a look at that. The other thing I thought it'd be just important to make clear is how the college works with other organisations. I think sometimes it can be difficult to understand the different responsibilities that different organisations have. Now, I suppose what I would say is that if you're ever not sure, and I always say this every year, if you're not sure, contact the college, and if we can't help you, we can normally point you in the right direction of the organisation that can. But as a college, for our training and assessment and examination activities, we're regulated by the General Medical Council. So our curricula, our examinations, assessments, any changes that we make to them have to be approved by the GMC and have to meet the standards that are set by the GMC. You will probably get to know the teams in your various deaneries quite well as well. And we work with them closely around ensuring that we have all of the information about your progress through training. And you'll also obviously then going right down to the bottom of this table, you'll be working in individual hospitals, trusts, and so on and so forth as you work your way through the training programme. We also work quite closely with all of the other medical royal colleges. The Academy of Medical Royal Colleges brings all of those colleges together. Quite often, some of the cases that we're making are common across all of the specialties. So we do keep in touch with colleagues from those colleges as well. These are just some of the documents that I was just referring to when I was talking about, how we're overseen by the GMC and the standards that we have to meet. So excellence by design is the standards for the development of postgraduate curricula. Those are fairly new standards, and all of our curricula are updated in 2021 to meet them. As part of that work, we had to also ensure that we incorporated the General Professional Capabilities Framework into our curricula. And then the Promoting Excellence documents is more for the deaneries. So the deaneries will implement the training that is set out in the various curricula that we produce and other colleges produce, and those standards apply to them. Just also a reminder that there is a national trainee survey every year. I think the report for the most recent survey has just come out in the last month or so. But again, it's really important that when those come round, you respond to those and give your feedback to the GMC, and that information is used and looked at to see where improvements can be made for training and support through training. And then just a quick overview of the role of the deaneries. So obviously we've got the Four Nations, and they're overseen by NHS England, NHS Education for Scotland or NES, the Wales Deanery, and then the Northern Ireland Medical and Dental Training Agency. And just on the bottom right hand corner there is just an oversight or overview of what the deaneries do and their role and responsibility in your postgraduate training. But as I say, if you're ever not sure, you can contact us and we can help point you in the right direction if it's not something that we can help you with, if you have any queries at all. And then just another very quick overview. It's really easy to remember the college email addresses because they're all follow the same pattern. But this is just a quick overview of who you can contact in the college if you ever have any questions about certain things. There's also an info at, so if you're just really not sure, just email info@rcpath.org and it will be sent in the right direction for an answer. But these are the four main teams that you might need to contact if you've got any questions, any queries, or even if you want to get involved in some of the work of the college. And that's everything from me. Thank you very much.
Thank you for that, Jo. As Jo says, I am Ed Cheesman. I'm a paediatric pathologist and I chair the Royal College Specialty Training Committee for Cellular Pathology, and I'm also head of school in the Northwest. So again, another welcome to the college and to histopathology training. I'm going to briefly talk you through the histopathology curriculum. And these are the topics that I'm going to try to cover. So we'll talk about the structure of histopathology training, and I'll also just mention the various specialties within histopathology. We'll explain what is expected of you in the first 2.5 years of training. That's the integrated cellular pathology training. I'll introduce briefly the curriculum and syllabus documents, but you would probably have seen these are quite big and detailed documents, so we'll just look at them briefly. We'll highlight the ways in which you'll do your learning in these first 2.5 years. We'll talk about what the assessments are that you're expected to achieve. And then just at the end, we'll just look at a few choices that you need to start thinking about at this stage of your training. So I'm sure you've already been to the training part of the Royal College website, and this is where all of the curricula are held and all of the other documents that you might find useful. So if you go to this training by specialty page, you will find more detailed pages for histopathology, diagnostic neuropathology, forensic histopathology, and pediatric and perinatal pathology. And you might want to delve into some of those documents to learn a little bit more about the specialties within histopathology. So this is the structure of training, and you will all be at this stage of the training, which is integrated cellular pathology training. And this will be where you are for the first 2.5 years of your training. And at the end of those 2.5 years, you can either continue into higher specialty training in histopathology, with or without the addition of special modules in higher autopsy training or higher cervical cytology training. Those are the optional modules. And without those modules, the training is 5 years, and you add 3 months for each of those additional modules. Another option is, after the ICPT, is to go into forensic histopathology, which is 3 years training. You can go into pediatric and perinatal pathology, which is also about 3 or 3.5 years of training, or you can choose to go into diagnostic neuropathology, which is 5.5 to 6 years in training in total. So those are the various pathways, and we'll talk about some slight alternatives to those towards the end. So what do we expect of you in your ICPT period of training? We expect you to learn what normal histology is, and that's really where you would probably start in your training. And once you know what normal histology is, then that's when you can start looking at what is abnormal, which is really what we spend most of our time doing in histopathology, is looking at abnormal histology. You'll learn about the safety and functioning of a laboratory and the dissection room. You'll learn how to safely assess, describe, and dissect samples in the dissection room. You'll learn about the safety and functioning of the mortuary and the post-mortem room. You'll learn to eviscerate and how to undertake an autopsy of pediatric and adult patients. And then a very big part of your training will be learning to apply your knowledge in writing histopathology and post-mortem reports, and how to develop a good clinico-pathological correlation for your clinician or for your coroner. This is ultimately what we are trying to do, is to provide useful information to our users. Hopefully you'll get some brief experience in pediatric and perinatal pathology and diagnostic neuropathology, and some of you might try to get some experience in forensic pathology. You will be expected to complete all of your workplace-based assessments, and we'll look at what those are a little bit later. You'll be expected to undertake multi-source feedback, and before the end of ICPT1, you would be expected to pass the Part 1 Royal College exam. So looking at the curriculum document, the curriculum is sort of outlined in what we call the capabilities in practice, and some of these are generic across all medical specialties. So within histopathology, there are going to be 11, we'll call them SIPs, 7 of which are the generic SIPs, which are generic to all of the medical specialties, and then there are 4 SIPs which are specific to histopathology training. So looking first at the 7 generic SIPs, and you probably would have seen some of these already in other parts of your earlier training. But essentially, the first of these is that you should be able to function effectively within healthcare and other organizational and management systems to deliver consistent, high-quality patient care. And this is really about working within the wider NHS. You should be able to work within ethical and legal frameworks across all aspects of clinical practice. You should be able to communicate effectively and share decision-making while maintaining appropriate situational awareness. And again, this is your interaction with clinicians, coroners, other service users, and how you communicate with them. And obviously, that's going to be a really important part of your training and ultimately your career. Of course, patient safety is always at the forefront of what we do, and this will hopefully be instilled throughout your training, and again, something that you will carry through into your career. As Bernie has mentioned, you should be able to contribute to and support research, or otherwise take a more significant role in research programs, either within the NHS or within academia. You should be able to be an educator within the confines of your role, and in fact, some of you will already be doing this. As soon as you essentially become a doctor, you take on some educational responsibilities. And finally, and quite importantly, you should be able to self-appraise, learn, and adapt. And this is something, again, that is not only part of training, but that you will need to do throughout your career as part of continual professional development, appraisal, revalidation. We then come on to the histopathology specific SIPs. There are 4 of them, and of course they're going to encompass all of cellular pathology, so they're going to be very, very broad. And the first of these is that you should be able to demonstrate leadership and management within a laboratory. And this is something that you will learn from day 1 in your training, and you will develop and become an expert in by the time you CCT. You should be able to use laboratory and other services effectively to investigate, diagnose, and manage your patients, including the deceased. You should be able to manage and contribute to the MDT effectively, and again, a critical part of your role, that interaction with service users. And of course, this covers probably the entire curriculum, is that you should be able to take, manage, and interpret pathological specimens accurately and safely, always considering risks to yourself and others. So each of the SIPs is further broken down by more descriptive terms. So I've just taken one of the SIPs as an example, and this is one of the cellular pathology SIPs. So this is the SIP regarding using the laboratory and other services effectively. So there are some descriptive terms for each SIP to give you and your educational supervisor more of an idea of what you are required to do in order to meet the competencies for that SIP. So for example, here is just a breakdown of what is required of you in order to demonstrate that you understand the functioning of a laboratory. I won't go through all of those. And each of the SIPs is further sort of broken down by the domains that are contributed to. So these are the 9 professional or generic professional capabilities here, and the ones that apply to each SIP are detailed within the curriculum, again, so that you can demonstrate the sort of the breadth and depth of your knowledge for each of the SIPs. And then finally, there is a box here showing you what evidence you can use to show that you meet the necessary requirements for each of those SIPs. So for example, the ePortfolio, exams, and the additional modules. To further help you and your educational supervisors to understand at what point during your training you should be meeting the curricular requirements, there is a breakdown within the curriculum. So for example, here you can see this is the first 12 months of training, the second year of training, and then the first half of your third year of training. And you'll see that for each descriptor, you build on as you mature within your training, you build on the knowledge and experience, and this gives you a nice breakdown of what is expected of each descriptor, and that you'll find that helpful when it comes to preparing for your ARCP. You will see in the curriculum there is a term called the entrustment level, and you will have come across this, I'm sure, in your earlier training. And the entrustment levels go from level 1, at which level you are expected to only observe a process. So for example, if we think of dissecting an appendix, for example, you're not going to go straight into the dissection room and dissect an appendix. The first one, you're going to observe somebody else doing that. Eventually, you will be entrusted to do that yourself with direct supervision to make sure that you're happy with what you're doing. Eventually, you will be entrusted to do that with indirect supervision. So in other words, you don't have somebody at the dissection table watching you, but if you do need help, then a consultant or a senior trainee is available for you to call on. And finally, at level 4, you will be expected to undertake the task in an unsupervised manner. Just one point here to note is that even though we all eventually do things unsupervised, there is always an opportunity to ask for help. And even as consultants, we will ask colleagues for help. So don't think that this is a level beyond which you have to always act completely independently. You can always and should always ask for help if you need it, no matter at what level you are. And then finally, you also see within the curriculum document, and you will need this when you transition from ICPT into higher specialty training, together with your educational supervisor, you should be able to say which entrustment level you are at for each descriptor for each SIP. So for example, understanding a method of validation. For example, if you're validating a new antibody for immunohistochemistry, of course, in ST1 and ST2, nobody is going to expect you to be doing that independently. But as you progress into your training eventually at ST4, ST5, you would be expected to be at entrustment level 3 or 4, and you can document this for each each descriptor and each SIP. There is a separate document to the curriculum, and that is the syllabus. The curriculum is very broad and quite open, whereas the syllabus provides you with more detailed information of what is required. And the reason that is because you will know that there are continually new things being found within histopathology, new molecular markers. So it's not practical to constantly be updating the curriculum with new requirements. So the syllabus is seen as an adjunct to the curriculum, and it's a guide to you. It's not, doesn't cover absolutely every single entity that you are expected to know about, but it's certainly a very good base for you to cover. And so this is really a guide for yourself and your educational supervisors. Again, just very broadly, and I'm not going to go into the details of the syllabus, but essentially the syllabus highlights what is required of you, and that means the main elements that are required of you are a deeper understanding of undergraduate medical pathology, the pathological basis of disease and anatomy. Of course, you're expected to understand the macroscopic and microscopic appearances of common disease processes. You are expected to understand the autopsy process. You are expected to understand the role of the history and clinical findings in interpreting your pathological findings. We don't work in isolation. We always take into account clinical history, examination findings, radiological findings. You will be expected to keep up with newer ways of working, and particularly with digital pathology, and some of you will become experts in this very quickly, as well as molecular pathology. You will be expected to produce reports, and you will become more proficient in writing reports. You will be expected to understand how a laboratory is organized, accredited, and managed. You will need to understand the generic skills associated with health and safety, legal issues, ethical frameworks, education, and research. And finally, you need to understand some of the subspecialties within cellular pathology. A very important aspect of the new curriculum is that this is a competency-based curriculum. In the past, we were focused on some extent to very strict numbers. For example, you had to do so many surgical cases, so many autopsies. And while the syllabus still provides a guide of the required numbers of cases, this is very much a guide, and you should be led by your own educational supervisor and TPD as to what is required of you. But very roughly, the expectation is that within your first year of training, you will see and report 500 surgical cases and about 150 cervical cytology cases and 150 non-cervical cytology cases. In year 2, this increases to 750 surgical cases and 200 cervical and 200 non-cervical cytology cases. But again, these are indicative numbers. They are not a strict requirement of the curriculum. You might be wondering, how do I learn all of these things that I need to know that are within the syllabus? And there is no one single way. Probably the best way for people to learn and the most common way for people to learn is through their day-to-day work. You will learn about most pathological diseases and processes. Of course, there are rare entities that you may not see, and you will have to refer to textbooks and online sources. You will do private study. People find black box and other departmental teaching sessions very important. Certainly during ST1, you will take part in block teaching. But further in your training, there will be regional training courses that you can attend, national training courses. You can choose to go to specific scientific meetings that you are interested in, and you will be able to apply to study leave and study leave funding through your deanery. You will learn a lot from your biomedical scientist colleagues, many of whom will be very experienced and have spent many years in histopathology. So always take the opportunity to learn from non-medical colleagues. Hopefully you'll get to attend lots of MDT meetings where you'll learn a lot, particularly about the clinical aspects of disease. You might choose to undertake some attachment in specialist centers or departments. We've already heard about the pathology portal, so there'll be lots of e-learning opportunities. You should share cases with your ST1 colleagues and with senior trainees, and they will do the same. So there's always learning from your colleagues. Work-based learning we've already mentioned. In some of the subspecialties, you might attend clinics where you would learn more of the clinical aspects. You will learn about laboratory simply by being present within the laboratory, going into cut-up, going and speaking with colleagues in the processing room. There will be other postgraduate training sessions that you can attend that are perhaps not necessarily histopathology or even pathology focused. There will be more generic training sessions that you can attend, perhaps around education or research. You will learn a lot through independent reporting, and that is something that we will touch on in a minute. So there will be lots of different ways in which you can acquire the knowledge that you need to get through ICPT. So independent reporting is going to be an important part of your training, and it's probably something that you need to start looking at certainly at ST2 level. Within the syllabus document, you will find this pro forma, which you might find useful, or you can create your own logbook of cases that you have reported independently and have had signed off by a consultant. And you should keep this as a record that you can take with you from one department to another. You will need to be proactive about this. In some departments, independent reporting is quite new, particularly for trainees that are pre-Part 2. But I think as soon as you get into your rotation, as soon as you have your first meeting with your educational supervisor at ST2, you should start talking about independent reporting. I'll talk briefly about the assessments that are required during ICPT. The first of these are the workplace-based assessment or the supervised learning events. And for each 12 months of training, or pro rata if you're working less than full time, you need to undertake 6 of the DOPS, direct observation of practical skills, 6 case-based discussions, 6 evaluation of clinical events, and 6 assessment of performance in the workplace. So there are 24 WBAs that you need to do every year. So make sure you start doing those early on so that you're not rushing just before the ARCP to get these done. You will need to undertake at least 3 multi-source feedback events during your training. And I say at least because within the curriculum, 3 is the minimum requirement, and you can initiate those through the LEPT website. I know that some deaneries ask for more frequent multi-source feedback. So for example, in the Northwest, we have a multi-source feedback every year of training. And then finally, you need to pass the Part 1 exam. Just very briefly, in terms of preparing for your ARCP, you'll find some useful documents on the college website. These are the decision aids, which you can upload to your ePortfolio. And again, these just are, in a way, provide a synopsis of all of the assessments that you need to undertake, as well as audits and other activities. And I just want to bring to your attention this form, which you're not going to need to look at for a while yet, but this is when you come to the end of ICPT training, you'll find that it occurs halfway through ST3. So it's kind of in the middle of the year. And at that point, just make sure that you complete this document together with your educational supervisor. And this just confirms that you have completed all of the requirements of ICPT. You need to upload this to your LEPT so that it's there for when you have your ARCP at the end of ST3. I think this is my last slide, and this is just to highlight a few things that you can start thinking about early on in your training, because some of them require some organization. Firstly, you need to start thinking about the additional modules within histopathology training. So if you're going to continue with higher specialist training in histopathology, do you want to do higher autopsy training, and do you want to do higher cervical cytology training? Start thinking about this, perhaps talking to colleagues and educational supervisors. I'm sure you've already started thinking about this. I would just say there is an increasing demand for consultants who have either of these or both of these certificates. So you might find at some point in the future, actually, these are helpful to you in getting the job that you want. So just something to think about. People often think, particularly with cervical cytology training, oh, I don't need to do this because this is only done in specialist centers. But there really is a need for consultants who have this experience, and you will really be putting yourself in a good position when you are looking for a consultant post if you have these modules. And then before you get to the end of ICPT, you really also need to be thinking, do you want to go into any of the other histopathology specialties? Do you want to be a forensic pathologist, a pediatric and perinatal pathologist, or a neuropathologist? And if you do, then please contact people within those specialties and arrange to do a taste a week or a few taster weeks, so that when you come to, because you need to interview for all of these specialties, you can show that you have a genuine interest. And again, certainly within pediatric and perinatal pathology, and I'm a bit biased here because I'm a pediatric pathologist, but I know also within neuropathology and forensics, there really is a great need for people in these specialties. So please do consider this and speak to people in those fields. And finally, you might want to consider taking a period out of program, whether that be for research or for clinical experience, or for whatever reason. That often takes quite a bit of organization in terms of setting up finance, setting up a research project, getting approval from your postgraduate dean. So if that is something that you might be interested in, then I would encourage you to think of that early in your training and start speaking to the right people. And finally, just to say good luck, and if you have any questions, please put them in the chat. Thank you.
Lovely, thank you, Ed. We do have some questions. So if it's okay, I thought I could just quickly run through some of those now. I know you're going to stay on, so if some more come through, we can cover them later. There are some exam questions that are coming through, but I'm going to save those until after Dr. Gill's talk. So the first question is, when can you start applying for higher subspecialty training? So I think that's probably sort of neuropathology, paediatrics and forensic.
So, well, applying and sort of making arrangements are two separate things. And like I said, if you're thinking about it, then it's never too early to start having conversations with people in those specialties, and also with your current educational supervisor and TPD, so that people know that you are thinking about it, and so that hopefully that they would be able to arrange for you to go and spend a week or 2 weeks within that specialty to make sure that that is what you want to do. I think for all of those specialties that there are two recruitment, certainly there is a national recruitment process every year. So if you want to, and they all recruit, your training starts at ST3 level, so you probably need to start thinking about applying in the year before you want to go into ST3 training in that specialty. But again, the sort of finer details of that you can discuss with your educational supervisor and the TPD, because they will know when well, certainly the TPD will know when the recruitment is going to open.
Yeah. And all trainees have to have completed ICPT and the Part 1, don't they,
That's right.
To be eligible. Okay.
Yeah.
All right. Lovely. Okay. The next one is, oh, you'll like this one. For those of us interested in paediatric postmortems, in a region where they are not offered due to a lack of paediatric pathologists, how could we go about trying to get some experience?
This is an unfortunate situation, and it highlights the need that we have for pediatric and perinatal pathologists, because there are regions in the country where there are unfortunately no pediatric pathologists. There has recently been a national TPD appointed, so we have a national pediatric and pathology TPD. She's called Dr. Liz Hook. She works in Cambridge, and she's only recently been appointed, but one of her things that she's focusing on is how we can ensure that exactly what you're asking, how trainees, particularly those who are interested in pediatric and perinatal pathology, but also for those who are not necessarily, but who do need to gain the exposure for the curriculum. Dr. Hook is looking at how we can do that. So I don't have an answer for you right now, but it is something that is being looked at, and it is something that is being discussed at the Royal College with all of the heads of schools and TPD. So you will be able to, your TPD will be able to come back to you with how you can do that.
Lovely, thank you. The next question is, what are the skills and evidence demonstrated in ECE? I think maybe, so what skills are we looking at when a trainee's got to do an ECE? What sort of skills is that covering?
I think that's very, very broad. I think there probably are some examples within the curriculum, but I think it can be any kind of event. It can be, I guess, cutting up a specimen, or perhaps discussing a case where there has been a misdiagnosis or something has gone wrong, or different opinions. It's very, very broad, and so I think there are some good examples in the syllabus or curriculum document.
Okay, what I'll maybe do during the next talk is just link, because we've got
Yeah.
all of that on the website, so
Yeah.
I'll maybe just link in there. The next one I could answer, but just feel free to chip in, Ed. So the question is it possible to dual train for examples in paediatrics and histo? So the answer to that is no. And the reason for that is because dual training programs are approved in advance by the GMC and set out in advance. There are only certain dual programs that are agreed. If you wanted to train in both of those things, so histopathology and paediatrics, you would have to do them sequentially. So it's possible to do it that way, but not as a formal dual training program. Is there anything else to add on that one, Ed?
I would just add that whichever one you choose, you will probably be so busy. It's not like you're not going to be kept busy in one or the other. I can understand perhaps you have an interest in various things, and some people do have a specialist interest, which sometimes overlaps pediatrics and adults. But like Joe says, most people, do CCT in one or the other.
All right. And then the next question is, there's quite a few coming through. So it takes 2.5 years to complete ICPT, which means you're already in ST3. Do you then transfer again to an ST3 post in the subspecialty?
If I understand that correctly, yes. So yes, essentially, yeah, it begins at ST3.
But the ICPT period is fully counted, isn't it? I think maybe that's what they're asking, is that you don't kind of go back to the beginning of ST3.
No. You're sort of halfway through, aren't you? Yeah.
Yes. Yeah. Okay. All right. And then we've got one about general autopsies. So is the total number of autopsies required 40 in the first 2 years, including paediatric autopsies? So the 40 that are required are any of those paediatric pathology, paediatric autopsies, essentially?
I think because numbers are not that important, I'm going to say it doesn't matter. If you can do 44, that's fantastic. If you manage 40, I think that will probably be fine. Obviously, that will be up to your own TPD and ARCP panel. But because, like we said, it's not a numbers-driven curriculum, essentially, it's very much a guide. So 40, 44, it doesn't matter. Those are good numbers.
All right, I'll maybe link out the bit in the curriculum as well, just to be clear on that. And then I'm going to do 2 more questions because I'm really conscious of time. This is a similar question to the one that we've answered already, but can we finish general histopathology and then later can we do other specialties?
I guess that's going to be very much up to the deanery and whether there is a post available. I guess within histopathology, you get 5 years of training. That is the post, and that is what the salary is for. You would have to then, I guess, apply for a training post after that if you want to continue training. So it's not guaranteed, and it will be depend on vacancies.
All right. And then I will try and get answers to as many of these as possible, but this is the final one for the time being. What is the minimum level of seniority of staff to send tickets in order to complete SLEs, such as DOPS and ECs, for example, ST4 and above, or only consultants? Now, I think there is guidance all around that in the documents and on the LEP system, if I'm right. But there is guidance on that, isn't there?
Yeah, and very, very briefly, it does not have to be consultants only. It can be senior trainees. It can be, experienced BMS staff. I would suggest the best thing, on a case-by-case basis is just to check with your educational supervisor that they're happy with the person signing it off if it's not a consultant or a senior trainee.
Lovely, thank you. And you're going to stick around for a little bit, aren't you, Ed? So if we've got any more questions coming through,
I can stick around until 12, Joe, if that's okay.
Lovely. Okay, that's great. All right, thank you so much, Ed. Okay, so next up, And we've already got some questions on this, on the exams, even though we haven't had the talk yet. So I'm expecting lots more. We have Dr. Mohammed Gill, who is the chair of the Histopathology exam panel, only just recently taken over. Also with Dr. Mariam Khan, who leads on the FRCPath Part 1 examination. So can I hand over to you both for your presentation, please?
Thank you. Thanks, Joe. I'll just see if I can share my presentation. Can you see it?
Not, oh, yeah, it's coming up. Hold on.
Perfect. Yeah, brilliant.
Yes.
Okay, thank you. Thanks. Yeah. Good morning, everyone. I'm, as Joe has kindly introduced, I'm Shafiq. I'm chair panel of examiners for histopathology, and I'm joined by Dr. Mariam Khan, who is lead examiner for FRCPath Part 1. So we would be talking about the scary bits in the training, hopefully make it look like less scary so as we go along. So just to give you an overview, in histopathology, I think as I give a quite nice sort of a background, we have what we call Part 1 examination, and then we have Part 2 examinations in 4 areas: histopathology, or we can, for the sake of discussion, say general histopathology. Then we have diagnostic neuropathology, peds and perinatal pathology, and forensic pathology. So broadly, the purpose of the exams is like one of the ways where we assess how people are progressing in their training. So these serve as what we call checkpoints or gateways. So once you have done Part 1, then you move to the next level of training, which is Part 2. Once you've done Part 2, then you can move to the next level of what we call final training or progression towards independent reporting. So and broadly, they are mapped against the curriculum, which has been, I believe, my previous colleagues have covered that in the morning. So Part 1 examination leads to what we call diplomate status, which can be people can use against them after their name, and Part 2 then gives you full FRCPath. These are one of the requirements for certificate of completion of training, but in itself, Part 2 exam does not signal end of training. Because in the UK system, we have another year of training after, which we call stage D, or final year of training, which then allows people to sort of basically further develop their skills before they're ready for their completely independent practice, or they can be given a certificate of completion of training. So examinations is one of the possible routes through which people can get their assessment. Other ways are people can get their specialist registration through published work, or if someone has experience of any different training program or environment with the right knowledge and skills, they can apply through a totally separate route which is called Caesar, or more currently portfolio route. So they have to demonstrate that they have the knowledge, skills, and expertise equivalent to what a trainee going through the regular structured program would have acquired by the end of their training. So this is what Caesar or portfolio training is. In terms of the general background information, both exams, one can take up to 4 times. And both Part 1 and Part 2. From the college perspective, so not everyone has the same needs. So if someone has any special or different needs, the people are provided what we call reasonable adjustments. So some people need a bit more time, some might need a bit different way of responding to their responses. So there is an element of reasonable adjustments. If there have been any issues, then any mitigating circumstances, they can also be considered. And if there is a proper appeals and complaints process, and broadly, again, it works under the framework of the General Medical Council, which deals with the training and assessment for all medical colleges. So let's start with Part 1 examination. So it's common to all specialties. So it's what at the end point of the integrated cellular pathology training. It's primarily an assessment of the knowledge and understanding appropriate for that stage of training. And it not only assesses the knowledge of histopathology, but also autopsy practices and pathology of disease or background knowledge, which is helpful in formulating a diagnosis. So whether it's like the disease biology or knowledge of basic sciences, molecular pathology, genetics, so anything which would help understand the clinical perspective, or which would help understand how to provide an interpretation and diagnosis of the material which is sent to us. So that's broadly addressed in the part 1 examination, with the clear understanding is what it would be reasonably expected from someone who has spent about 1.5 to 2 years in histopathology training. The format of exam is 125 multiple choice questions, which have to be completed in 3 years. It includes a combination of single best answer type questions as well as extended matching questions. These are delivered via an online platform through an independent provider called TestReach. So one has to register with TestReach, and then exam material is uploaded just on the right time, and then you can access that. You can go through the exam material, submit your responses. So it's primarily an online or virtual examination. So as I mentioned earlier, part 1 allows you to then progress to the next stage of training, and that also gives people opportunity to, if they want to branch into any of the the subspecialist areas, you can say, or the other specialties like neuropathology, peds, perinatal, or forensic pathology. At the next stage of the examination is part 2, which is taken roughly about 2 years after part 1. The format is quite different from part 1. This is mainly a face-to-face examination, which is focused on assessment of practical skills and more geared towards assessing someone's readiness for independent practice, and just seeing that they have acquired enough sort of accumulative knowledge, skills, and experience where they can then start looking at how they can have the background understanding, can formulate a response and a meaningful, pass on meaningful information to the clinicians, and also have an understanding of how the specialty works in terms of multidisciplinary team meetings, dealing with laboratory issues, any rapid diagnosis like frozen sections, and covers both histopathology and cytopathology. I know there was one question previously on the chat whether there is a separate exam for non-gynae cytology. So there are 6 different components in this exam which are taken over 2 days, and non-gynae cytology is one of those. Because it's face-to-face, so it's delivered through multiple examination centers, which are some based in the UK, some are spread over globally. And we have just recently added 4 more centers, and we are constantly looking for adding more centers as the number of candidates that are taking the exam is increasing. The responses, some are written responses, some are like face-to-face Viva type situations or OSPI type situations. Overall, there is a closed marking system. So basically that means that you are marked within a limited range. And then how people perform, especially candidates who have not been successful, they are provided quite itemized feedback, which helps them in understanding what went wrong, where there were deficiencies or gaps, and that helps them then better prepare for the next time. In terms of the basic concept of this exam is not to catch people out, find deficiencies, or find faults. It's primarily aimed at assessing the knowledge they have, and are they ready to then move to the next stage of their training. So it's really helpful, because it's a practical examination. Is the more understanding of practical aspects you have, whether it's looking slides under the microscope, reporting under supervision, dealing with any lab management or any clinical governance related issues, dealing with any incidents, complaints, concerns, also participating in quality assurance and systems like further development in the lab, clinical audits. So it really covers not only just the diagnosis, but more of a holistic approach, looking at whatever would be expected to be dealt by a consultant histopathologist. So in terms of preparation, it's basically preparing all those aspects during your training. So it's just being prepared as you go through your training rotations, that it's all of these elements go hand in hand, and being ready for those. In terms of what other considerations, like the exam format, again, there is a lot of information on the college website, but we constantly keep on reviewing the exam format based on the feedback coming from the candidates, from the examiners, from other sources, to look at its fit for purpose. It addresses all the components we are trying to assess, and it gets reviewed and updated. So I would recommend keep an eye on the college website, see if there are any changes. We are at the crossroads of, as just like the overall pathology reporting, we are moving from the traditional microscope-based system towards digital pathology, and potentially also artificial intelligence coming in. So it is a time for major change, and obviously the examination also has to be aligned to those major changes. So discussions are starting about how, as digital pathology is being rolled out in day-to-day practice, how we develop assessment systems which can incorporate digital pathology. It will be a major undertaking, so it most likely it will be managed in a very controlled way through a pilot program, and then managing all the logistics. There will be a proper process for GMC approval, and then it will be broadly aligned with other Royal Colleges. So I think as you go through your training, you might start seeing those changes, but generally any changes to the exam structure are advertised well in time, and they are communicated to candidates, so they have the time to then understand the new changes and prepare for those. Overall, the main purpose, as I mentioned, is to map it against the curriculum and the syllabus, to assess people have covered all the key components within the curriculum. If we look from the endpoint perspective, then the examination is primarily an assessment to see that our future pathologists are well trained, they are ready for independent practice, they can confidently interpret and diagnose the patient material, provide a meaningful diagnosis, which will help in the further management of the patient in terms of making decisions, whether for their treatment, for their prognosis, or for, as we are integrating genomics and genetics into that, or molecular studies, also sometimes providing that information for risk assessment with the rest of the family. So it's a multifaceted approach to assessing those skills. And then the final bit is also, it's an assessment that as we go through this process, whilst we are competent, but we are also, we are aware of our limitations, the system with which we work, we can safely deliver those services and seek help where appropriate. So it's broadly focused on all of those elements. So as mentioned at the start, examinations by their nature, because they are an assessment in that point in time, they have an outcome based as fail pass. So they inherently generate a bit of anxiety and can cause stress, and there are usually time limitations within that. But the better understanding you have that, for example, whether it's part 1 or part 2, the more information you have, the more focused preparation you have done, they should not be as scary. If in an ideal situation, this should be, especially the part 2 exam, should be another day in the lab, because it's primarily an assessment of just how we will work day to day. So I think the only word of advice I can give at this point is, as you start planning to start your training, is not leave any exam preparation as a standalone separate thing right towards the end, but it's just gradually building your skills and having an understanding of the system, and taking feedback from your supervisors in terms of an ongoing gradual preparation rather than last minute one. And that sort of preparation really helps. And there is no such thing as over preparation, because again, obviously, being well prepared not only helps you with getting through the examination, but it also helps you with your future life. So I think it's just doing your training in that focused and targeted way from day one. So that's the only bit I can say. I've intentionally kept it short because I thought then we can have opportunity to take up any questions. Okay, thank you. I also have Dr. Mariam Khan with me, so we can share the questions if there, but she has more understanding of the part one related issues. Thank you.
Lovely, thank you. Did you want to do some of the questions now?
Yes, please, we can do that.
Yeah, okay, all right. Let's have a look. So the first one is, what are some common challenges trainees face during the FRCPath examination, and how can we best prepare for them early on in our training?
Thank you. I'll do the part two, and then I'll pass it to Dr. Khan to help with the part one. Part two is an exam delivered over 2 days. It's a very high-paced exam covering 6 components. The major challenge we face is like you have 20 surgical cases, 8 cytology cases to is time management. We realize candidates sometimes struggle. If you have not practiced well, people struggle in managing time, and that causes sometimes stress and anxiety. The examination material has to be rotated through all the candidates, so it can't be with one candidate beyond the prescribed time. So that's being prepared for that. So I would recommend practicing. The other bit will be, we are looking for, when people are providing their candidates for an interpretation of their exam material, it will be roughly the same as we would expect from in day-to-day reporting. So really focusing in your day-to-day reporting, that the reports you write, although you're writing under supervision in a shadowing environment, but being alert that you're picking up that skill, whereas if you have to independently write that report and gradually learning that. So by the time you go to the exam, then it's just, as I mentioned earlier, it's just another day at work. And finally, I would say, as I mentioned, is not only focusing just on the slide interpretation, but it's having that holistic view of the clinical information, what the macroscopic information, microscopic, and then how this information fits in how the clinicians will use this information in making management decisions. And regarding part one, I'll pass on to Dr. Khan. She can.
Hi, can you hear me?
Yes, we can.
Yeah. So obviously, I think Dr. Gill has summarized very well how to do the part two. Now, the part one, obviously, it's a bit a daunting experience for a trainee who has just come to join histopathology. It's a new field and everything looks new. The exam itself is 3 hours, but I would just say that as soon as you have entered this field of histopathology and your first day, just start not just preparing for the exam, but be involved in the practical aspects, be involved in the knowledge, involved in the practicalities of histopathology. Try to liaise with your colleagues, your senior trainees. That is a very important aspect of learning. The part one exam itself has got like components involving your practical aspect of slide interpretation, knowledge testing. It also involves the post-mortem knowledge. It involves general knowledge. So it's a very difficult exam to set up, to take everything into consideration. But my advice would be, as with part two, from day one, just start acquiring the skills which are needed for the exam. Start building up your knowledge base as well as your skills. So basically, the skills tested are only for a trainee who has just in the first 2 years of training. So it's not a higher skill testing that is required in part two, but obviously it is a lot of things to cover in 3 hours of exam. So basically, my advice would be the same as Dr. Gill has said, that start preparing from day one, and I think gradually things will build up.
Lovely, thank you for that. Then we've got, I think you touched on this in your talk, Dr. Gill, but it's probably just worth us clarifying because there's a couple of questions on this. So the CHCCT which is the gynae cytology exam, there's been a question about, is there a separate exam for non-gynae cytology?
Yeah, I think as I mentioned earlier, the non-gynae element is assessed in the part 2 histopathology. So that is covered there, which basically there are 8 separate cases, purely cytology based, which are assessed separately. You have to pass that module or component of exam to pass the whole exam. So anyway, it's covered there.
Yeah, so the CHCCT and also the CHAT exam, which is the autopsy certificate exam, those are to examine those relevant parts of training for trainees who choose to continue in either cytology, cervical cytology or autopsy, aren't they? So those are the only 2 additional certificate examinations.
That's right.
Yeah, okay. All right, so that's fine. So that's another couple of questions answered. And then we've got, okay, so so talking about the CHCCT again, so the trainee is asking, can you only do the CHCCT after finishing 5 years of training, or is there an option to completely branch out to cytopathology at ST3? I think I'm struggling. I think what they're asking is, can they just do cytology at ST3? And I know the answer to that is no.
Yeah, because I think these 2 certificates are after your FRCPath examination. So they are like add-on modules. Once you've done your FRCPath, then you want to acquire additional skills. So they are not like a replacement for the main exam. So not standalone.
Right. That's right. So the only specialties that you can branch out into after ST3 are pediatric pathology, neuropathology, and forensic pathology. So they require you to go through another recruitment process to go into those. The certificate exams really sort of reflect a big change that was made to the curriculum many years ago. And it used to be that all trainees were examined in all of cytology and all of autopsy, part 1 and part 2, wasn't it? And then cervical cytology and autopsy were removed from the part 2, but there are these certificate examinations for trainees that choose to carry on in those 2 areas. So I hope that's clear, but if anyone's got any more questions on that, then please do ask. I think I've explained that correctly, haven't I?
Thanks.
Okay, all right, so that's that one. Okay, so there's another question here. Does passing part 1 prior to initiation of training, not sure what that means, but I think what this is asking is, does passing part 1 prior to the end of ICPT reduce the duration of training? I think that's what that question's asking.
Yeah, so just let me see. Yeah, I think I'm just trying to understand the question. So yes, if someone has like they have completed their part 1, and they have part 1 as Ed mentioned is one component in assessing the overall the completion of ICPT, and I think if their educational supervisor or their program director then assesses with the support from the college that they have acquired all the relevant skills for the ICPT broadly, then they can move on to the next stage. So I think it's more of a case-to-case basis rather than like a generic.
That's right. And I think it's also looking at all aspects that are required to complete ICPT as well, isn't it? So it's not just the exam. There's obviously all of the workplace-based assessments and the requirements of that period of training. So yeah, I think that's very much case-by-case basis. Thank you. I think that is it for all of the exam questions. Okay, is there anything else more to add on the exams?
I think I saw one question. Someone says, how many of non-invasives can be done in that 20 numbers? Oh, it might be related to the previous talk, isn't it? So
Yeah, I think that's for Ed.
Yeah.
So I don't know, Ed, if you want to come in and just answer that question.
Yeah, no, I don't. I thought maybe it was part two. I think I don't fully understand. So it might be related to the previous talk. So
I think it's related to the curriculum requirement
yeah,
for 20
okay. So yeah,
autopsies. Yeah.
I mean, so when the
Hi.
curriculum refers to, I guess, doing an autopsy, it's referring to a full autopsy, or a standard autopsy rather than a limited or radiological autopsy. If that's the question, then I think, again, the numbers are not that important. So, but I think there will be an expectation to do some full standard autopsy examinations.
Okay.
Thanks,
Okay.
Ed.
Okay. And we've just had another similar-ish question to one we've already answered, which is about if someone's passed the part 1 before they've joined training, can they shorten their training period? So again, that's a similar answer. We are just about to publish actually some guidance around all the various ways in which prior training can be counted, and along with an update to our out of program training being counted, and also acceleration of training as well. So keep an eye out for those because they will be published shortly. All right, just conscious of time, I think if we keep moving along in the agenda, Ed, I think we've covered all of the questions for you as well. If there are any more that come in that we can't answer, we'll circulate those afterwards.
Okay, perfect. Thank you.
Thank you.
Lovely. Thank you. Thank you, Dr. Gill. That's really helpful. Thank you very much. So let's keep moving then. So our next speaker is Dr. Alastair Tansley, who briefly met at the top of the webinar today. Alastair is going to give you a demonstration of the LEP system. So I will hand over to you, Alastair.
Sure. I will just go ahead and share my window, if I can get the right one. Here we go. Okie dokie. Hopefully, can everyone see this screen?
Yeah, yes, we can see that.
So, first off, my name is Alastair. As mentioned earlier, I'm the ePortfolio officer who works with Sandra in the assessment department to do with all things LEPT. That is, you can see down here, the learning environment for pathology trainees. I will be the first point of contact for any questions that you may have regarding this. And I also help to maintain it, to run updates, check things are all going well, and to help trainees where I can with any issues they're having, as well as ensure smooth processes over the ARCP period along with the training team. So the LEPT system, learning environment for pathology trainees, is essentially the system you'll be using throughout your training to keep track of your assessments that you undertake, whether it's CBDs or DOPS, that sort of thing, in order to allow you to fill out things like your ESSRs and your ARCPs, where the ESSRs are these educational supervisors structured reports, which is one of the things that the ARCP panel likes to see. So just based on all of the training that you've been doing, your educational supervisor can review and just say how things are going. And then annually, in terms of competence assessment, there's the specialist annual review of competence progression, where there's the ARCP panel that will ensure that you've been attaining all of the relevant goals that they would expect you to have completed throughout the training year that you're in. So I'm going to give you a bit of a run through of how to access this. First off, you simply just go to the RCPath website, rcpath.org. I've already logged in for convenience, and then you will be clicking on Learning Environment for Pathology Trainees down here. That will then bring you to your page when you've logged in. If you have any login issues, there are buttons that you can click to say, I've forgotten my password, etc. And you can also email us if you have any issues with logging in. So this is the page that you'll first see. And On your homepage, I'll first point out that we have all of these different labels here. So educational supervisor, training program director, head of school, ARCP, etc., etc. When you first log in for the very first time, you will be asked to put in your ES, your educational supervisor, and your TPD, the training program director. For the training here, we've just got members of staff on this particular account. These are the main two that you will need to put in at first, otherwise you won't be able to use the system. And this is just because when you're doing assessments, you'll be submitting to your educational supervisor for the ESSR, and these are just the kind of essential ones that you'll need to get going. When you've then put those in, you will see a screen that looks a lot like this. The main areas of note. First, we have alerts. This is where myself and Sandra will be updating you with any relevant information that you need to know. So just things like, say, this educational update meeting, 8th of November. So things like this to keep a look, to keep track of what's going on. So do keep an eye on this to see if there's anything new, because this may also answer questions if we're having any potential issues with the system. This is most likely I will put a message to let you all know. Second, we have your tasks menu. Right now, there's a couple of tasks in here. That's just for the training purposes. You will have 0 to begin with. But when you either start and save an assessment to submit later, or when a supervisor or an assessor has returned your assessment to you and you need to review and accept it to make sure you're happy with everything they've said, it will be here just for your convenience so you can see if there's anything outstanding. Messages, you can use this to directly message people through the LEPT system who are also on the LEPT system if you would like. Obviously, there's nothing stopping you using your emails if you have that email, but maybe occasionally this will be an easier way for you. And then, as mentioned, we have your training card. This will be a very quick glance for you to assess how things are going throughout your year. The training card with all of these details and your year of training will only appear when you first start an ARCP on the LEPT account, which is what I'll be showing you a little bit later. And when you will then see these little loading bars, which let you know how many of the different assessments you need to complete that you have done up to the total indicative number for that year. So for this ST1 practice record account, we're saying there's 666 and 1 MSF. These will then light up green as we go, and you'll be seeing that later until you hit the total. There's absolutely nothing to stop you doing more if you so desire, but this is just a guide so that you can see how far along you are with the minimum that you need to do. Only other couple of things for the homepage, you can move these around if you would prefer to, say, have your training card there, but broadly, as it is perhaps best, because it means you can see the alerts that we've put, your current tasks and any messages straight away before you then scroll down. Very finally, I'm going to mention this release tab here. This button allows you to change your professional relationships. This is to allow you to edit all of these, educational supervisor, training program director, etc. Things like these first 3 you'll be getting from your deanery, and ARCP representatives and panel chairs, they're not things you need to worry about just yet. You will be given these people when the ARCP is approaching. So if that says nothing for you, that's completely normal up until your ARCP. But should you need to change anything, like say you've changed supervisor for some reason, you click on this button and then that will bring up a screen to let you add in new people who are also on the LEPT system. Just a little note, this release button takes a little while to load up. So when you've clicked it, do wait sort of up to 60 seconds and then it should load up for you. Next, I'm just going to show the profile page. This is where you'll be able to see at a glance the main information that the LEPT system has on you. So obviously your title, the email address that we have registered for you, name and surname. In terms of email address, this is the email address you'll be logging in with. If you need to change this, you can either do so by emailing us at assessment@rcpath.org, or it would be through your main page under sort of My RCPath that you can change it there. When you do, the LEPT system takes in general about 24 hours to update with new info, so don't expect to be able to log in with your new email that you've changed immediately. Use the old one until sort of the next working day, at which point the system will have updated. You can put a photo here if you so desire. It's not mandatory, but maybe it can be helpful for anyone who is accessing your profile for the ARCP or just for your assessor to know that they've got the right person. But just do be aware that if you do put a photo here, anyone who has viewing access to your account will be able to see that photo. Here we have portfolio user details. Good way to just check that everything seems correct to you. You are able to edit almost everything on this page, except this year of training. So you are very much welcome to put in your job position as, for example, ST1 trainee, but do note that that won't necessarily update the year of training. So when you get into ST2, for example, if this hasn't updated, changing your job position won't update the system itself to let the system know that you're now ST2. For that, you would need to email us or the training team, and we'd be able to sort that out for you. Yeah, workplace, specialty, you can put those in, again, just to help anyone reviewing your record for ARCP, etc. Your GMC number, your national training number, which is a number that will look something like this, which you will be given, and please do add that because that's very helpful for both us and the training team. And then a CV if you so desire, but again, that's not mandatory. So next I will, actually, very first thing I wanted to also say, on the alerts page here, you'll notice we have this LEPT instructional videos. This will bring you to a page where we have a YouTube playlist with a bunch of different videos that were made by Sandra and my predecessor, which tackle pretty much everything that you could need to know about the system. So although this talk is being recorded, so you can refer back to the things I'm saying here, if ever you need to just be reminded sort of, oh, what do I need to do to be able to make an ASSR? Oh, the button's not appearing for that yet. It will be here under this playlist, so please do use that playlist. That's also accessible under this help tab here. Okay. In terms of ARCPs, when you click ARCP or the Create and List sub-tab, you will at first see nothing at all, and you'll be able to hit Create ARCP. There'll be a button in this top right here. The reason there is not one right now is because we already have an open ARCP, and it is only when there are no open or marked as under review ARCPs that you'll be able to create a new one. So if you're having trouble with that, you've got into a new year and you can't make a new ARCP, it's likely because your previous ones don't say closed. So the ARCPs, we very much recommend that you put your dates to match your training year dates. So this is very broadly what your training year date may look like. In terms of the actual ARCP panel date, you won't know that yet. So for the time being, when you're creating an ARCP, just put a date at some point after the end date of your ARCP year. You can then add in the details you know. Once again, you may not, or you won't to begin with, have the ARCP panel chair and representatives. That's fine. Should you need to change dates, if you've made a mistake there, you can change these right here just by clicking edit. I've put one little additional detail here, which is a note to myself to remind me to say, please don't use this form for mid-year reviews. Some trusts will conduct mid-year reviews, that's perfectly fine, but the ARCPs are not, the ARCP forms on the LEPT system are not designed for those. And if you do one and submit it, it has to go through the usual multiple people that we would have to for an ARCP, such as your supervisor, TPD, head of school, etc. So it's just a little bit difficult if we have used that, because then you may not be able to make an ARCP form for your actual ARCP. And note that at the moment we have 0 assigned items because we have not assigned any assessments to this ARCP yet. And that's also why the training card on your home screen says nothing, nothing, nothing. So let's say you've done an assessment and you want to log it on your lab system. You simply either go to assessments and click on that, or create and list, and goes to the same place. And you'll then be able to see a list of all of the different assessments you have done or still to do. Clearly, to begin with, this is going to be empty for you. To create one, you would simply click on the Create button, select who it is that you want to approve the assessment, so whoever assessed you in doing it. So for this, I'll just put myself. And then you have the ability to choose the different form that you want to complete. And we have pretty much all the ones that you will need in terms of your official WBPAs. That's the work-based place assessments. So work-based placed assessment. When you've then selected that, you can then click Create Assessment. In later years, you will have the ability to be an assessor for workplace-based assessments for those in training years below you. So there'll be another section under here which will say to create an assessment for someone else. That's not for you to worry about right now, but just when that does come around, make sure that you are clicking either the button underneath this, which will be linked to creating for another person, if that's what your intention is, versus this one here, which is just for one creating for you. Here we have the MSF assessment bit, which again, in ST1, you will not be able to do anything with. This is your multi-source feedback, which will be initiated in your first year by the college at a later date so that everyone starts at the same time. So you'll all be in a cohort together. From ST2 onwards, you get to choose when you initiate your MSF. So you will have the ability here, which is currently not there for this ST1 profile, to create an assessment. Well, let's say I'm just creating a case-based discussion. I click Create, make sure the date is correct and that this date falls within the ARCP period that you've listed, because otherwise you won't be able to assign it to that ARCP. Double check that everything here looks correct to you, who the assessor is, what you did, and then you can add in all of these details here, which you'll need. And obviously the more detail, the better, not only for your educational supervisor when they're doing a review, also for your assessor, also for the ARCP panel to see the details that you've done. But now I'm just going to just say best and just put that in because all of these are mandatory ones. Yeah, so note, you can obviously put these in, and then we have a section here which is feedback completed by the assessor. Maybe during the assessment they gave you some feedback, so you are welcome to put some things here yourself. Just do be aware that when you submit to the assessor, they will have the ultimate ability to change these, and then they'll send that back for you to review. So do just double check that you're happy with what the feedback was. For now, I'm just going to save this as a draft so that I don't have to go into my account to approve it, because this then shows you what that will look like if you've saved one that you haven't yet had time to put in all of the details for. It will just show as incomplete, and you'll have the ability to edit or delete it should you need to before submitting it. When you have submitted one, while it's waiting sign off by your assessor, it will just say awaiting approval by whomever. Then when you get it back, you'll be able to review it to make sure that everything looks as you were expecting. And you will see that it says under status, no association. This just means you have not associated it with your SIPs and GPCs, which were mentioned in a previous talk, and that it's not in any particular ARCP. So to do this and to start ticking off these various competences, you just click on the associate with the SIPs and GPCs. You can then pick which you think are the most relevant ones for you. For example, demonstrates the ability to offer apology or explanation when appropriate, and these will then autofill certain domains based on what you've clicked on. Obviously, if you feel that one of these hasn't come up based on something that you selected, you don't have to just select from these, although it's ideal if you're able to. I'll just click these, and you'll find that they do tend to populate pretty quickly because these do come under quite a lot of these various domains. You then just click Add. We've now associated them with all of these, and you'll be able to see the entire form that you've completed with your associations there. Should you now want to add this to an ARCP, we then click ARCP under the options there. Right now it's under Keep in Portfolio because you've not chosen to assign it to anything. Click on this, select the ARCP. Once again, you should only have one there because there should only be one open at a time, but just double check to make sure. Select it and click Assign. This has now then been assigned to your ARCP. When we then go into your ARCP list, you now see there is a number 1 instead of 0, and it is now clickable. So you can then click on your ARCP and see that it is there, when you did it, etc. Now to mention, and sorry, I know I am rushing through this, I don't expect you to remember everything. Do bear in mind this is being recorded. I'm just trying to get through everything in time. When you have, firstly, an open ARCP, and secondly, when you have assigned a workplace-based assessment to that ARCP, you will then have the ability to create your ESSR when it is relevant to do so. And you'll obviously be discussing with your educational supervisor at the point that you need to do that. Relatively simple. You click Create ESSR, confirm that you want to, and confirm also that ESSR content, so everything within it, will be locked when it has been approved by your educational supervisor. This is worth noting because it's only anything that is in that ARCP that will be populated into your ESSR. So make sure that you've put in all of the assessments that you want to be included before you create it. When it's then created, we then have it here. You'll have some extra details that you can fill in, and you'll be able to sort of go through this and comment on various aspects of it, maybe with your educational supervisor, and then you'll be submitting and sending it to them. Or you can save it again for later. All right. So that's assessments, listing your assessments, associating them with your ARCPs that you've created, and then when it's relevant under the ARCP, you will be able to create your ESSR. We have a few other tabs here. So your training and development tab allows you to list personal activities. And this is for things that don't necessarily come under the workplace-based assessments. Things like audits, logbooks, even attending a new training welcome day. Should you want to put that in, you can then create it and associate it with an ARCP, just so that once again, the ARCP panel will be able to see anything additional that you've done, whether that's, like I say, audits, or you've published something, or you've attended a conference, that sort of thing. Anything that's related to your training and development that isn't captured within assessments. Then finally, you have the ability to create and list personal resources. This can just be things like proof that you've gone to certain conferences, certificates, anything at all that you think is relevant in terms of files for the ARCP panel or your educational supervisor to be able to see. Again, this isn't necessarily a mandatory part, it's just anything you think will help accompany your assessments and the various aspects of the ARCP that you've done. Finally, I'm going to once again draw your attention to this Help tab. Under Contents, we have a number of very useful documents, which may not all of these will necessarily apply to you. Some of them will. And once again, I would like to point out here the list of LEPT instructional videos, which once again, step by step, go through the things that I have talked through today. So you can go back and double check, because as you may have noticed, certain things such as the ESSR and the ability to create a new ARCP, those buttons won't be available until you've satisfied certain criteria. So if you forget exactly what it is you need to do to jump through those hoops, look through these videos, and you'll then be able to hopefully find your answer. If, however, you've done that and you're still struggling, or you're having some kind of error or issue with your LEPT count, please do get in contact with us. There's a contact tab here where you can do general feedback, report an issue. Doesn't matter which one you pick, they both come to us, and you can just then detail what's going on, apply sort of the URL and any other details, and have a copy of this email too. This will then land in our inbox, and we'll then be able to respond and hopefully resolve your issue. Obviously, at the same time, you can just email us if that's easier for you at assessment@rcpath.org, and it will likely be me who responds, or Sandra, my manager, and we'll be aiming to help as quickly as possible and resolve any issues for you. So do please get in contact with us should you have any problems. I believe that is everything. Oh, the one extra thing I'll show. Because we associated an assessment with the ARCP, you'll see that we now have one of these green squares has now been filled. By the end of your year, hopefully all of these will have been filled, and it will look beautiful and full, and then you'll be ready to submit. Once again, this training card is just a really nice, quick summary so that you can see sort of when ARCP is, when your what the status of your ESSR is, along with your tasks. So in case there's anything that you've saved and you haven't yet done, or anything that is just awaiting being sent off to your supervisor or someone else. Just taking a look to make sure there's nothing else that I've missed.
Alastair, we have some questions, so I'm just wondering, while we've got you and while you've got the LEP system up,
Absolutely.
just quickly run through the questions. I'm just going to slightly change the running order of the rest of the programme. We will be finishing on time, but Dr. Roberts, who's the chair of the TAC, couldn't be with us today, so we have a recording for her. I can see that Luke is already here to present to you about the pathology portal, so I'm going to switch those round so that Luke can start at 12:10, which is when he was expecting. Then we will hear from Dr. Roberts, and then we'll clear up any more questions that we have after that. But there are some questions about the LEP system, Alastair, so perhaps we can just quickly run through those. So the first one is, when should we enter the ARCP details?
So when you have, so you'll be able to do a sort of a draft ARCP to begin with, and it's then when you have these further details from your trust that you'll then be able to enter those in. But ideally, you'll be wanting to create this in draft form at the very least, just as soon as you're able. There's no rush. It's just useful to have that here so that you can begin associating any assessments at the earliest possible opportunity, just for your convenience, really. But as long as it is created and you've then associated everything by the ARCP date, that's the main thing.
Okay, all right. So it's highly unlikely that ARCP dates will be available yet, and as you've said, some of the individuals as well, but those can all be added afterwards, can't they?
Yeah, this can be fully changed. Just put in an arbitrary date to begin with that ends after your the year ends, and then closer to that date you'll then be able to update it with the actual ARCP date and the actual panel chair, etc., etc.
Lovely. Okay. The next question is there a form we need to complete for educational supervisor meetings?
There's no specific form. This would likely come under things like your personal resources or training and development, where if this loads, you'll be able to create, and you can then add in what it is that you've done. So this is typically specifically for files and just for resources, but should there be something like under training and development, you can create here and then add in things. So this may be a good place to put your educational supervisor meetings just for your own reference, and so that come ARCP and come ASSR, they can look at your progression throughout.
Yeah, but we don't provide a structure for that, so that's just
no. It will just be under this form for anything, and you'll just then title this educational supervisor meeting, etc.
Lovely. Okay. So the next one is, could you explain what you mean by demonstrating curriculum outcome? So I will start the answer, and then perhaps Alastair, if you can finish. So the curricula, as I think Ed went through, are divided into specialty specific and generic high-level outcomes, also known as capabilities in practice, so SIPs. So I think what you're required to do in the LEP system is, when you're putting all of your evidence in, is attribute it to the relevant high-level outcomes of the curriculum, so that at a glance your supervisor and everyone else in the training programme will be able to see how you're progressing through the curriculum. Is there anything to add on to that, Alastair?
I think you've covered it pretty well. You can do it for anything, although it's not required for resources and not necessarily required for training rotations, but under your workplace-based assessments, we would recommend just clicking anything that you think is relevant. Obviously discuss with your supervisor to ensure if you're not certain, but anything that you're able to tick off to say, well, I did this autopsy, and therefore within this I was able to, I don't know, teach someone, and you were training a medical student at the time, let's say, you can then go, okay, this was definitely demonstrating effective treatment, teaching, training, supervision, etc. And feedback to them. And then that again goes into the generic professional capabilities that are then auto-selected based on what you've selected here.
Lovely, thank you. The next question I think I can answer, which is about how to find the corresponding SIP in the syllabus for each workplace-based assessment. So if you look at the histopathology syllabus, you will find the very first column. So the syllabus just gives you the detail of what is expected of you during your training. If you look at the very first column, just get an example as I'm talking to you. There's a column called areas of learning, and then there's knowledge, and then there's skills. The areas of learning column gives you the SIP number that the knowledge and skills is referring to. So that should be able, that should help you to match up the syllabus and the SIP when you're doing your workplace-based assessments. Is there anything else on that one? I think that's sort of, you've covered that already in the previous answer as well, haven't you?
And you've covered that perfectly well as well, I think.
Yeah, lovely. Okay. There's lots of questions about uploading various things. And again, I think we've covered this, but I'm just going to quickly merge some of these questions, Alastair. So how should we upload the training agreement? Where can we place our personal development plans, I think that should be, for the year? And where can we upload certificates for online training?
Once again, under resources, this is for things like certificates, that sort of thing, any kind of file. So this, you'll be able to distinguish this from training and development based on the fact that it asks you, is this a file or is this a website address? And when you are then uploading something, you'll be able to pop it here, and then when you selected file, choose your file, upload it, and just mark it based on what it is. And if it's relevant, associate it, but that's probably not going to be relevant here because this is supporting something that you've mentioned under your assessments or your training and development. And then it's under training and development where you may want to add other things where you're not necessarily putting the evidence of it, but you're just stating what it was that you did for example, audit, logbook, other presentation, teaching activity, all of these come under the training development supported by uploads and under your resources. I hope that is clear and answers it.
And someone else has asked about explaining the uploading of the logbook part, which you've actually just briefly touched on there as you were demonstrating that. So I hope that that's clear for everybody, that essentially you are able to upload a lot of information, a lot of different files and things to support the evidence of your progression through training. Excellent. Okay, do results of FRCPath Part 1 need to be uploaded into the LEPT system?
I believe that's done, I want to say automatically by the training team, though, yeah.
Yeah. So that your results will automatically be uploaded into the LEP system after the results have gone out to you. So you don't need to put them in separately yourself. Then there's another one. What is the difference between personal activities on LEPT and the CPD portfolio, and what should we be recording in each of those? I think what I would just say is that you shouldn't be using the CPD portfolio. You should only be using the LEP system while you're in training. CPD is for post completion of training. I hope that you haven't done too much in the CPD portfolio. Please make sure everything is in the LEP system, because that is specifically tailored to training and demonstrating progression. Another one, Alastair, how often do we need to do an ESSR?
That's typically only once a year, and that will be in discussion with your educational supervisor. I don't know if this has any outcome forms I can look at. Yeah, here we are. When you've done your ARCP and it's all been signed off, you'll get an outcome form that most of the time will say everything's fine, moving on to next year, and you will have just the one educational supervisor structured report listed, along with just one MSF listed. So it would broadly just be once a year or once every ARCP, let's say, which again should be once every year.
All right, I'm really going to race through another couple. Sure. Which section should we upload our ES form to?
So again, I think if there's a form that is separate and it's already in a file, go to resources and create, and then you'll be able to upload the file. And then if you were to then also add an activity that's related to that, you can then reference that there is a file that you've uploaded alongside that when you create and list your personal activity here.
Okay. Right, thank you. Could you clarify how long the MSF link lasts before it expires?
So that is, so for your first year, we will give you, I think it's sort of at least a couple of months in which to do your MSF, where you'll have you will select a number of people, up to, I think it's 12 people, to sign off or review you. This list will be reviewed by your educational supervisor, and then when that's done, you will then see that there is a specific end date. This end date will vary depending on, well, we get to set it because this will be in next year, sort of around June time that you would be expected to have done this by. But you don't need to worry about creating that MSF yet. You will be given all of the details at the relevant time, and then links to access it will be just, they should last the entire time. But if, for example, an assessor has lost the email with that link to assess you in, then you can send them a reminder. Much like there's one here, if you're awaiting approval, there's this remind button that will also be available under your MSF when that's relevant to you, but that's not here yet, of course.
Lovely. Okay, I'm going to draw a close there. There are some more questions, Alastair, so if you wouldn't mind sticking around for a bit and maybe just answering some of the ones that are left in the Q&A box. And then if there's time at the end, we'll come back to any that we haven't managed to do. But without further ado, I'm going to move on to Luke Thrower, who oversees the pathology portal for the college, and he is going to run through a demonstration of that for you. So over to you, Luke.
Great, thank you very much, Joe. Oh, is my camera not working? I've just...
It's a blurry blob.
Oh, that's weird. Here we go. Oh,
that's
okay.
better.
There we go. Much better. Hi, everyone. My name's Luke. I'm the Pathology Portal Officer at the college. I'm going to give you a quick run through about the Pathology Portal to give you a bit of context. The catalogue available on the NHSE Learning Hub. Portal was launched in August 2022 and offers a collection of 5,500 resources across various specialties, including things like case studies, lectures, recap videos, podcasts, and quizzes. These resources have been accessed more than 200,000 times now by over 4,000 users from different backgrounds. Over the past 2 years, the project's grown quite a lot. We have more than 100 editors now, including trainees like yourselves, working on developing content, and we've been recognised with awards from the HSJ and the Healthcare Honours, and also getting some great feedback from users saying how the portal has supported their development. Now I'm just going to share my screen for the next stages here. Great. Joe, you okay? Just to confirm for me that you can see that?
I can indeed.
Perfect. Great. So it's quick and easy to sign up. Information on this can be found on the college website, on the Pathology Portal section. You'll find our support email on the right-hand side here, so that'll get picked up either by myself or Rebecca, and we'll be able to help you with any of your questions. It's also worth noting that as well as having the access to the portal buttons down here that will guide you through registration, you can also link your college login so that you can get a single sign-on. Yours, the first time that you do it, you'll have a button here that says create/link your college account to the Pathology Portal, and once it's linked, you'll get it changed to access the Pathology Portal like mine is. So if we click that, as I'm already logged in, it will take you directly onto the Pathology Portal. Now, the first time that you log in, if you haven't requested access to the Pathology Portal yet, you'll have a green button up in this top right-hand corner, and that will say request access. We usually respond to those requests pretty quickly, so you shouldn't be waiting around too long to be able to access the resources. On the main page of the Pathology Portal, we have lots of different folders covering the specialties as a whole, and then those get broken down further into their subspecialties. If I jump into the autopsy one here to give you an example, you'll see it's then further broken down. These grey cases are part of the admin rights that I have, so you won't see those when you log in. And then if we go into a kind of subcategory, you'll see that a lot are laid out with a level 1 through to level 5 sort of format. So that's taking you from level 1 being what's considered basic through to level 5, which is generally the more complex stuff. If you've not used the Pathology Portal before, I will just give you a really quick look at some of its functionality. But I would say that the best way is to explore it for yourself and discover the content. There's lots of stuff there. So it's great just to have a kind of look around. We go up into my bookmarks here. So here we've got something that is out of the lower GI category. And this is going to show you one of the main selling points with the Pathology Portal and the Learning Hub is the ability to access whole slide imaging. So this is a whole slide image that's been uploaded. It's had some annotation points added to it by one of our editors. And then these are really high quality images that you're able to zoom into, and you're able to kind of rotate the images. And then below this, We have some teaching information guiding you through what some of these annotations are for. Some of the resources that we have, you may have accompanying videos. So some of our autopsy content has some great videos that run alongside the whole slide image, walking you through what you are looking at and what you should be seeing. Some of them have quizzes or associated kind of long cases for you to work through, so you can get taken through kind of several stages of a investigation, and these kind of vary resource by resource. Like I have, you are able to bookmark and rate resources. So if there's things that you find particularly helpful, you can keep track of them in your own bookmarks, so you can create your own library. That's done by just doing a add to my bookmarks list here, and then you have my bookmarks up the top here. So then you can find either particular resources, or if you want to bookmark the pathology portal specifically, you can do that here as well. Up under My Learning, you'll be able to download a PDF of content that you've viewed. So if you want to use that towards just kind of proof of learning that you've been doing, you can also, apologies. You can also look over the previous resources that you've accessed. So if you want to go back and take a look over anything, you can do that there as well. As the pathology portal is quite large, sometimes relevant resources may also be present within other areas. So you can utilize the search function if you're looking for a particular topic. So as opposed to kind of having to search through the catalogue individually, you can search directly into here. And then it will give you just results that correspond with that. You can then sort and filter these results as well. So if you're just looking to watch a lecture, or if you're looking to work for a case, or you only want things that have quizzes or assessment elements, then you can do that as well. Finally, I want to say that we do really value your feedback. Obviously, as I say, we've got lots of resources, so users getting in touch with us, letting us know what's good, what's not, what can be improved, where there might be gaps for things that they're particularly looking for. And also, if you yourself want to get involved in volunteering with the pathology portal and are interested in adding cases, we're always really happy to hear from you as well. We have lots of trainees who help us to kind of bulk out some of the gaps and work with some of the other editors. And it's great for getting involved with kind of teaching content and working with other people. So if you'd be interested in doing that, it's that same email, contact pathologyportal@rcpath.org. And we would be really happy to speak with you about that.
Brilliant. Thank you, Luke. That's really helpful. I'm sure everyone will be making use of that and hopefully contributing to it as well. We don't have any questions for you, but if anything comes up, I'll give you a shout. We're going to move straight on to our final presentation, which is a recording from Dr. Sophie Roberts. She is the current chair of the Trainee Advisory Committee, but she's a dual trainee in medical microbiology and infectious diseases. But the TAC has representation of trainees from all of our 17 college specialties. And it's a great way to get involved with the college. I meet with the Trainee Advisory Committee every 6 months just to discuss various issues. I will also just say at this point that we are gathering feedback about this event today, and a web link to a very short feedback tool is going to appear in the chat very shortly, and we would be really grateful if you could just take a couple of minutes to complete that feedback before you leave the session today. That would be great. So Louis, could I hand over to you to show Sophie's video, please?
My name's Dr. Sophie Roberts. I'm a specialist registrar in infectious diseases and medical microbiology, and I'm London-based. And I'm also your Trainee Advisory Committee chair. And over the next few minutes, I'm going to explain to you what the Trainee Advisory Committee does, and how you can communicate with us and how we can communicate with you. So in terms of what the Trainee Advisory Committee actually is, the first thing to say is that the Royal College of Pathologists is inclusive, collaborative and approachable. And we, as a national committee of trainee representatives from all 17 pathology specialties, sit on a range of boards, and we are your voice at those meetings. So you can bring issues to us and we can address them with the different boards, and then we can feed back to you. So the Trainee Advisory Committee members sit on the Examinations Board, the Medical Examiners Board, Digital Pathology and Diversity and Inclusion. And the idea is that as a committee, we're able to provide feedback to those committees, and we can ask any questions that you may pose to each of these committees, and then we can feed any of the information back to you. We're approachable all year round, but importantly, our meetings do happen at the moment biannually. So any issues that may be addressed at these meetings can also be taken to any of these other high stakes meetings. Just a little bit more about what the role of the Trainee Advisory Committee is. So as I've said, we represent you, and you can contact us at any time. We're contactable either by email, and I will provide the email at the end of this talk, but we're also contactable via a series of WhatsApp groups and also on X or Twitter. With regards to the emails, we will endeavour to respond to you in a timely manner, but it's important to acknowledge that everybody who works for the TAC is a volunteer, and they are fitting all of these responsibilities around their clinical responsibilities as well. So just give a little bit of a leeway, and if we haven't responded, please just give us a nudge, email us again, and we'll get back to you as soon as we can. Now, importantly, if we are unable to answer any of your queries, we will almost always certainly be able to direct them to somebody who can help. And a person from another team will give us the information that you require, and then we will feed that back to you. There are several different ways that you can also get involved with the Trainee Advisory Committee. One of them is the College Bulletin. Now, this has a trainee section, and it invites articles and book reviews regularly from trainees across all pathology specialties. I will provide you with the contact details for the College Bulletin so that if you have something that you would like to contribute, you can get in touch. The other thing to say is that there's a dedicated committee page, and I've put the link on the next slide, and I'll tell you a little bit more about that now. So in terms of what you would find on the dedicated committee page, first of all, at the top of this slide, there is the link to our page. And on there, what you will find is a list of your Trainee Advisory Committee representatives. Have a look through the list, see who yours is, and if you have any questions, get in touch with them and they can feed back to the Trainee Advisory Committee directly. The other really important thing to note is that the minutes for all of the previous Trainee Advisory Committee meetings are available on this website. This gives you the opportunity to read through what's been happening over the course of the last year, a couple of years, and you can see the kind of issues that we address and the kind of questions that have been posed to us and the kind of answers that have been given. The other thing to say that's really useful on this web page is that there are a list of vacancies for the Trainee Advisory Committee. So if you would like to get involved, we would be more than happy to have you on board with our team. At the moment, there are some vacancies, so please do have a scroll through and see whether you might be the kind of person who would fit into one of these roles. This is a great way to develop skills beyond the immediate clinical work and your clinical skills. So, fabulous way to develop teamwork, communication skills, and leadership skills. And as I said, we'd love to have you on board. Just a little bit more information about how the Trainee Advisory Committee actually works. So at the moment, we meet twice a year in May and November, but we are contactable at any time. And we have fabulous administrative support from Louise Mayer, who is our Governance and Committee Services Officer. It's important to say that we are trying and looking to meeting more regularly throughout the year. This is something that we are in conversation with the RCPath about at the moment. And this is with a view to just driving a little bit more momentum more momentum and being able to affect change more effectively throughout the year. Now, this, as I said, is a work in progress, and we will keep you updated in the event that we do meet more regularly. In terms of communicating with us around these meetings, approximately 10 weeks prior to each Trainee Advisory Committee meeting, all pathology trainees will be emailed a link to an online question portal. And this gives you the opportunity to write in with your feedback and questions, all of which are anonymised. The questions are then reviewed by the Director of Learning and by the Director of Examinations, who are able to then formulate a response. This response is then brought to the Trainee Advisory Committee meeting, and they're presented by Joanne Brinklow, the RCPath Director of Learning. And by bringing these questions to the meeting, what it means is that you then get the major stakeholders being able to have a look at the questions and the answers provided, and we review these and we debate about whether we've given you the best and most well-informed answer to your question. Now, in terms of the other people who would be looking at your questions and providing input with regards to the answers, you've got Nikki Cohen, who's the Clinical Director of Examinations, Professor Marta Cohen, who's the VP for Learning. Feeding this information back to you, the individual will receive a written response after we finalised our response. But equally, the responses are anonymised and minuted in the Trainee Advisory Committee minutes. And these are what are put onto our dedicated homepage, which means that everybody then across the country, pathology specialties, can have a look at the answers to these questions. But as I've said, these are anonymised, so nobody will know who submitted the questions. Now, the other really useful thing about this meeting is that we get an update from the college president, and this allows the Trainee Advisory Committee to understand about the internal workings of the RCPath and what's been going on and where we fit in with that. So it's a great way to have a two-way conversation. So as I said, this is a meeting where all of the major stakeholders with regards to your training are present. So it's really, really, I can't impress upon you enough that if you do have questions, please do submit them via the portal and you will get a really well-informed answer to your question. Just a little bit more about the activities and projects that the Trainee Advisory Committee are also involved in. So we have the pathology portal. Now, this, if there was one single resource that I would direct you all to, it's the pathology portal. This is basically an online digital learning platform that has a series of cases, and it's appropriate for anybody, those who are at the start of their training and trying to develop their knowledge, to those who are taking their exams, because each of the scenarios presented on the digital pathology portal give you a flavour and an idea of the framework of the type of questions that you might be approaching in your exams. Equally, there are slides associated with these, and some of these slides will reflect some of the content of the exam. So I really recommend having a look at this. Also, if you do look at this resource and you think that there's a knowledge gap that you are able to fill with a case that you have seen during your clinical practice, then we want to hear from you. This teaching resource is a constantly evolving resource, and we want trainees to contribute to it. So please do get in touch. I've made sure that the contact details are available here for you if you have a case that you think that you would like to present and help build as part of this project. The other important thing to say is that the Trainee Advisory Committee are involved with several public engagement groups, and we would love for you to get involved with these too. So there's the RCPath BDIAP Foundation undergraduate event, and this is an annual event. If anybody would like to get involved with this, it's going to be happening relatively soon. So please do get in touch with us and let us know. I think the Not in the Textbooks event is really important in terms of thinking about expanding your skills beyond your immediate clinical knowledge. So this is an event that helps trainees think about mentoring, leadership, and also, as I said, management skills. So do have a look at that too. And then there's National Pathology Week, which happens annually. And there'll be all sorts of events going on up and down the country. And if you're running an event we would love to hear from you and to hear about what you've been doing. The other thing to say is that there's really useful support for examinations on the RCPath web pages. So my predecessor, Matthew Clark, created a series of webinars called What I Wish I'd Known. I really recommend for those who are thinking about sitting their exams to have a look at those. Then, if you have any ideas for new projects or ways in which we could develop the projects that are already in process, please do get in touch, because, as I said, we're always wanting people to participate, get involved, push things forward, and fresh faces, fresh minds, always welcome. The other thing to say is that the Royal College is heavily committed to diversity and inclusion, anti-bullying and harassment, well-being and support. And at the moment, there's also a big push to promoting transparency and supporting discussions around errors or mistakes in pathology. So I've provided a series of links here that you can go back to and have a look at if you would like to get some further information about any of these topics. This is the beginning of your training, and so you need to think holistically about your own training and development and who is going to facilitate that. So I've talked about our role as the Royal College and the Trainee Advisory Committee, but what you may also want to do, if you don't feel comfortable approaching us directly, is to think about people who are maybe slightly closer to home. So your peers will be an immediate source and an extremely useful source of support and information. So please do speak to your colleagues. Then there's your educational supervisor. If you have any issues around learning, probably the best person to speak to about those initially is your educational supervisor. And if they're unable to answer any questions, they will then escalate that to the appropriate person, who may be your training program director. Your training program director is integral to your learning, your development, and your pathway through training. So please find out who they are, get in touch. They're usually extremely approachable and supportive people. And then, really importantly, your local trainee representatives, because they will also be able to communicate with us directly if there are any training issues. So if there's anything going on locally, please let them know about it, because they will be able to generate and affect change much more easily locally than we might be able to. And of course, as I said, as the Trainee Advisory Committee representatives, we are also around all the time and approachable, and we'd love to hear from you. Just having a little think about training opportunities. So remember, you've got local teaching, so you'll have departmental teaching, trust-wide teaching, and then you'll have your regional training days. If you're not sure about these and you haven't been added to a mailing list, please get in touch with your trainee representatives about this. Then there are the RCPath conferences. Emails will get regularly sent to you about these conferences. Have a look at those. Maybe attend some of them. In fact, you could even present. And that would be fabulous in terms of developing your skills and content for your portfolio. And then there's thinking further afield to international conferences and research. I've put on here a link to the RCPath funding pages, because the RCPath does occasionally fund primary research. So if this is something that you think you might be interested in, please take a look at that link. Finally, just to say, get involved and please stay connected. So as I've said, send us an email, ask us a question via the question portal, especially in advance of those Trainee Advisory Committee meetings. And then we do have our own X or Twitter handle. It's @PathologyHouse. We've got over 5,000 followers, and we'd love to have some more. So please come and join us. And there we will, as I said, post the portal link in advance of each of the Trainee Advisory Committee meetings. And if there are any other events or presentations or updates from the RCPath, you will see them on X. Please get involved. So you can contact the College Bulletin if you have any ideas for contributions. I've put the link in here, or the email address for them. It's publishing@rcpath.org. And as I said earlier, we are available by email. Our email address is chair.rcpath@gmail.com. And we really look forward to hearing from you. Welcome all, and have a fabulous training, fab beginning to your training, and love to hear from you. Thanks so much.
Fantastic. Great talk from Sophie there. That rounds off the new trainee welcome day. Please can I remind you once again just to pop into the chat and fill in the feedback if you haven't done so already, just so that we can review what we do and maybe make it even better for next year. Can I just say it's just been so fantastic to have so many of you with us this morning and staying with us and asking so many questions. You've really put us through our paces, so that's really good. So that, I think, just leaves me to thank everybody again, thank our presenters, thank the training team who have organised this morning. Please keep an eye out for the recording of this. It will be available on the college website if you want to go back and revisit any points. Please remember, if you've got any outstanding questions, you can email the team and they will get back to you as well. So I wish everybody a good rest of your day, great weekend, and I'm sure you'll be in touch with us soon. Thanks very much.